Will there ever be a cure for cancer? In a way, this is kind of a trick question because cancer, some cancers are curable, particularly found in early stages. Some cancers are curable in even late stages. But then another aspect of this question is, what do we really mean by cure cancer? So if someone has cancer and it's treated, and they have regular monitoring for 5+ years, and no cancer shows up, and they go on and live their full and healthy life. Has the cancer been cured? It could be that there was a dormant cancer cells sitting in their body that were unable to form tumours, maybe because of the immune system. So yeah, it's kind of a trick question and kind of a tricky question. So yeah, there are certainly cancers that have even quite a high cure rate in when found in early stage. So early stage cancer where it hasn't spread, hasn't grown too much. In some cases, you can just have cancer removed by surgery and doesn't seem to reoccur. If it's maybe single tumour, and if it's removed with what's called clear margins, which means the surgeons test some of the tissue around where the tumour was, and they don't find any cancer, so they can be relatively confident that they've got all the cancer. Yeah, I think it's fair to say some of those people are, at least for practical purposes, cured. There may be other cases where you can have cancer removed and then remaining cancer kept under control for many years, possibly to the end of your natural life. I don't know if is that being cured. Is it being treated as a chronic disease? So we think of disease as broadly being like acute, just short term, and chronic, kind of much longer term. But yeah, it is really important to understand that plenty of cancers are curable at early stages, and it's becoming more and more common for even stage 3 cancers to be treated with curative intent, and in some cases, stage 4 cancers, the so-called terminal cancer, it can still be treated with curative intent. That's quite a recent thing, but it's very possible that some of those people are going to go on and live to their full life expectancy. And I think, yeah, at least on a practical level, we'd say those people have been cured. So an example of that may be someone with colon cancer that's spread just to a couple of distant lymph nodes and maybe a liver tumour. That could be treated with curative intent in some cases. Often when people say, will there ever be a cure for cancer? What they mean is will there be a single universal cure, or maybe a single set of cures? The media often talk about the silver bullet for cancer. Ill-informed people often talk about finding the Achilles heel of cancer. Cancer is very unlikely to have an Achilles heel. It's been around for a very long time. And our body has multiple defenses against cancer. So cancer cells, cancer tumours, I should say, are pretty robust, tough. Cancer cells, one weakness they do have is their poor at self-repair. But because cancers are able to grow and spread, the cancer is able to persist over a long period of time in many cases, unfortunately, they're able to take over the patient. So yeah, I think the kind of cancer having an Achilles heel thing is a bit of a silly thing to say. I do think that at some point there will be at least a set of treatments or a treatment protocol consisting of multiple treatments that will cure the vast majority of cancers, even in late stages. I'm kind of seeing the beginning of that happening here in Japan. A big thing that needs to change, though, for that to happen in cancer care is that immunotherapy has to be the main treatment for cancer patients, and all the other treatments should be to support the immunotherapy. Immunotherapy shouldn't be this last-ditch treatment or this very kind of expensive, unusual thing. Immunotherapy should be the standard treatment for pretty much all cancers, with other treatments supporting the immunotherapy. Okay, I hope that is a useful answer to the question, can cancer be cured?